Item 2 would be our update on COVID-19, the Public Health Director, Kathy McKay. And Jamie. Morning.
Good morning. All right, we handed out the weekly data, and as you can see, the changes aren't significant in the cumulative cases. We have 92 deaths in Clay County cumulatively, and that's the same as it was last week. The active cases have continued to drop, which is great. They were 129 last week, and now we're at 81, so it's really great to see the continued decline of active cases. The median age remains the same. Hospitalizations, we have cumulative of 339 in Clay County and 31,398, and the report from the epidemiologists throughout the state of Minnesota is those numbers continue to decline, hospitalizations and those that are in ICU. Also on the North Dakota side with our healthcare systems, they're seeing declines as well. Our 14-day case rate per 10,000 is 33.44, so that has declined as well, as we would expect. It was 40.60 last week, so we're really seeing the benefit of the people that have availed themselves to the vaccinations and those that continue to adhere to all of the public health prevention measures. Our Clay County cases per week, we just have the graph that also just shows the peak and then the decline that we've been experiencing lately. The active cases per age group, and it is the 10 to 14, so that's a little bit of a change where we're seeing more of the younger age groups that are experiencing the COVID. And we do have authorization, as you may all have noted in the reports, that the authorization for the Pfizer vaccine from the 12 to 15-year-olds is out, and Jamie will talk more about those vaccinations and how we're addressing that need. And then the next cases that are the highest by age group is the 35 to 39, sorry. And the cumulative cases by age have been the 20 to 24, so that's been consistent as well. We talked about on the next graph, the hospitalizations per week, which are declining, and the Clay County deaths, which has remained the same, and then the statewide hospitalizations per week, we're seeing declines across the state, which is great.
Great. Questions on those numbers? Jamie.
Okay, so looking at the data, I will let you know that we've talked a lot about whether the numbers are accurate in the data that we share each week. And we spent quite a bit of time last week working with the Minnesota Department of Health, and we were actually able to get information on people that were informing us that they were vaccinated on the North Dakota side and they were not in the mixed system. So the good news is that the state is working on that now. So again, looking at the data for Clay County, we have people with at least one dose of vaccine at 40.5%, and people who have completed the series at 35.1%. And I'm not going to go through all of the details of that, but flipping it over to the state side, state with at least one dose of vaccine at 61.6%, and then people with a completed vaccine series of 53.1%. And again, all along, we felt like we were at the state level in Clay County, and we just needed to collect some actual data to present to the state to get them to work on that. So we're pleased that that is on their priority list now. And then we brought the zip code information that tells you the percentage of individuals that have been vaccinated by zip code and the population, and that population still is 16 and over, they haven't included the 12 and over in that yet, so that's still 16 and over that remain to be vaccinated in the zip codes. And then looking at Clay County Public Health vaccinations, things continue to be very slow for us. Last week, we administered 234 doses, and 70% of that is second doses. So we're seeing each week that we're focusing primarily on second doses based on need and interest in vaccinating. And then on the bottom of this graph, we also have been sharing the percentages on the North Dakota side for Cass County and fully vaccinated, and those with one vaccine dose, and then North Dakota as well as a comparison to Minnesota and Clay County. And then the last is the cumulative cases by zip code that we've been sharing for data too, just looking at, and again, from the very beginning, the doses by zip code. And then I'll just kind of talk a little bit about what we're doing this week. As I mentioned last week, well, and I didn't say the total, I guess, I apologize. So as of the end of last week, Clay County Public Health has administered 14,275 doses of vaccine. And this, looking at this week, we are going to have 2 clinics, aside from going into some of the homes of the homebound people that we've been vaccinating. We're doing some second doses and some first doses, and then also doing some follow-up with second doses of Pfizer for 16, 17-year-olds in the schools this week. But we'll have a clinic on Wednesday from 3 to 6, and we have 30 doses of Pfizer for second doses. And then we have 30 doses of Janssen on Wednesday as well from 3 to 6. And then on Thursday, we have a clinic from 1:30 to 3:30. We have 100 doses of Moderna, first and second, available, and then 100 doses of Johnson & Johnson. And then what we've been doing for the last week is working with the schools and making plans to vaccinate those kids that are 12 and over. And so the school nurses are helping us to push that information out to parents. So what we will be doing is getting consent from parents as well as having them do the registration on the link and online. And so some of the schools, 2 of our schools are wrapped up already, but they're talking about their summer school programs and their summer activities, meals that are delivered on a daily basis. So they've been communicating with us on opportunities of how we can serve them. So that will be our focus for next week for sure.
Commissioner Gross?
What is the situation as far as people getting more than vaccinated twice? I see there's incentives sometimes for getting a vaccination. Okay, well, there's a $5 incentive for a donut or what have you. Okay, you want another donut so you get vaccinated. Is there a problem with getting vaccinated twice?
Well, they're encouraging people to come in who have not been vaccinated.
Well, I realize that, but if you're going to give me a donut, then they come in again. So,
But
I
this
just
is
want
the
to see a
series.
problem with being vaccinated twice.
It's not the completion of the series you're getting twice. It's the second dose of the 2 dose.
Right.
Yeah, is that what you're?
No, I'm just asking.
Commissioner
They took
Gross.
Johnson & Johnson and took that twice. Is there a problem with that inflict some sort of harm to a person?
If they took the 1-dose vaccine, Johnson & Johnson, and actually came in and got a second dose, that's a 1-dose vaccine. Pfizer and Moderna are the 2-dose. The only thing we're seeing with hesitancy about getting the second dose to complete their series is if they had a pretty significant reaction to the first dose. Some people are hesitant then for the second dose. So we're seeing that. And sometimes there's some people are getting a physician order if they had a pretty severe, like say, more of an anaphylactic reaction. So sometimes their physicians will say, don't get the second dose. So they're following what they're
I
prescribed.
just wondering, I read where I think, I don't know where state it was, that they give students an incentive for a $1 million drawing or something like that.
That's Indiana, I think.
Indiana
Indiana,
was having there's some incentive to go in there a couple of times to get a shot, isn't there? And I was just seeing, is that a harm to give incentives here or vaccines?
No, Commissioner Gross, we have not offered incentives, and that's not been the typical case across Minnesota, nor has Minnesota Department of Health recommended incentives. If this board would like to offer some incentives, that's totally up to the board's decision, but public health has not offered any incentives.
Well, I know we haven't, but I was just wondering, is there harm in getting it twice? I guess that's my question. I've had the dose, I don't know, back in whenever it was, if I go get it again, would that affect my health?
I think what we've because at some point there will have to be a booster, which is the same as your influenza booster. And so, yes, it's not advised because I got the Johnson & Johnson. It would not be advised for me to go get a second Johnson & Johnson right now, nor probably someone who has completed their 2-dose series. At some point this fall or further down the line, it will be helpful and recommended to get a booster. And I think that's maybe what you're hearing.
Well, I'm just concerned about people. I'm very concerned about my health. I had my shot. Now I just want to make sure, I really don't get it. I'm only 95% safe now with that vaccination. I want to be 100% sure, so I'm going to go get the shot again. How long in between? Should you wait, or if I go 3 months apart, is that okay?
No, Commissioner Gross, we check in every facility that provides vaccines. We verify that you haven't received the vaccine. If you come back in, you've already received it, we cannot give you another dose, nor can any medical facility or pharmacy. So we're verifying that you've already received a dose. There has not been some firm information about when that next dose, some call it the booster dose, if there's an annual booster that's required, just like the flu vaccine. We haven't gotten that information yet. That hasn't been verified. So if you come in and you've already had the vaccine, you cannot get it.
So you've got it on record somewhere that I got the vaccination?
Correct.
Very good. Thank you.
Any further questions?
Maybe one thing Commissioner Mojo, I wanted to mention, as Jamie talked about Minnesota Department of Health trying to catch up with getting some of the data on our vaccinations because we're on the North Dakota border. We know it's not accurate. We also pushed out a press release and information to the media for those that were vaccinated in North Dakota pharmacies or with the Fargo VA. Those are the two entities we cannot get the vaccination information. It's not in our immunization registry. So we push that out for people to contact us, and we'll enter it ourselves into the Minnesota registry so we can get a little bit better accurate data. And I know the first day, I think we had 90 people that responded that are letting us know that they received the vaccine in North Dakota, and then we can put that into our registry. So we're trying to also help locally as well as the state to get our data a bit more accurate.
Kathy, I think that was a really good segue to the point I want to talk about next. Over the last year, your department has done a phenomenal job with re-envisioning how we get information out to folks. You've done a really good job on social media and dealing with the news outlets to make sure that the people are getting the information that they need to as fast as possible. Having you come every week has really been helpful, and it's important for us as decision makers to see the trends, to see where there might be gaps, to see how we can help you. And I know that it's a lot to come to the county board every single week with the data that you do. But I'm wondering now, because sometimes it's been changing so fast, by the time it gets to us, it's maybe a week old, to make decisions on things. And I think we've done a good job of addressing the needs where there are. Wondering if it's necessary for you to come to this board every week to give an update, if maybe it would be more appropriate of your staff time and prep time to come every other week. I think you'll continue to update social media and get information out as it's ever changing. Not sure what this board's wishes are. I would be open to discussion on that, but I would certainly maybe propose that option.
Well, I would definitely agree with you on that. In fact, I tried to do that because a couple months ago. I think every other week would be sufficient. I mean, if something comes up in a week, get on the agenda, there's no big problem getting on the agenda. So I think every other week would be sufficient right now as we move forward.
Commissioner Cayley?
Agreed. I think it's a better use of staff time to have them focus on their other efforts and their I mean, this is just one piece of their job. They have this whole other spectrum of things that they're dealing with as well. So yes, get on the agenda if there's something important. Bi-weekly seems like a good fit to me.
Commissioner Ebinger.
I'd agree with that as well.
Okay, good. Well, certainly you've heard from us. I know that you'll continue to update as information comes out to get the information to the public, and we'll do our best to share that. But I think until there, hopefully we don't see a spike, but from now on, maybe do every other week and we can go from there.
Okay,
Work?
sounds
All right.
good. Thank
Well,
you.
Thank you for your work.
Thank you very much.
Do we need to vote on that piece, or is that just a recommendation? No? Okay, perfect. Kathy, I think you'll be here for the next piece.
Oh, okay.
Thank you.
Thanks, Jamie. I would like to take our agenda addition right now, if that's okay. As all of you are aware, Thursday afternoon, the governor changed some direction on some recommendations, and I know that we've had staff members and members of the public reaching out to us to see how would we adapt to what was recommended. The PIC committee did meet this morning. Because Commissioner Campbell is out today, I did sit in on that with Commissioner Gross so that we could discuss our safely return to work policy. So Steve, if you'd like to.
Thank you, Madam Chair. As you put it very well, I think that with the changes of recommendation of the CDC, MDH, and ultimately Governor Walz's Executive Order 2123, we put a packet of information this morning before you, and we appreciate your flexibility in allowing us to have this discussion. I think it's an important one. And so, if you recall, back in May of last year, we were required through executive order to bring forward a safety plan to address returning to work. And in part of that safety plan, both in May and July of last year, we established policies on masks and also on social distancing that now would not be conducive with the new executive orders and recommendations. And so we wanted to bring this before this board this morning to have a discussion on and to provide some discussion and direction on how you would like to move forward. As I mentioned, you have a packet in front of you that includes the executive order that lays out the expectations of 2123. You also have our respiratory etiquette portion of our Safely Return to Work program that lays out the expectations of that. As Commissioner Mojo mentioned this morning, we did also have a PIC meeting, and as we've done with our Safely Return to Work process and many other issues, that PIC committee has met and brought oftentimes a proposal for this board to consider. And so we were able to meet this morning as a PIC committee, and the document that we would propose to have language for on our web page and potential news release is there. But again, the point we'd like to do first would be to have a discussion from a commissioner's standpoint.
Okay, thank you. Commissioners. Commissioner Ebinger.
I think one of the things we need to be aware of is that the vaccine is here. And unfortunately, we can't question people as to their status of being vaccinated, but we can make it contingent upon them being vaccinated that they not wear a mask. We don't make the inquiry about vaccination. We're going to assume we're going to do this on the honor system, that if we have an employee that comes in and they're not wearing a mask, it's because it's at least 2 weeks after their last vaccine. We having somebody wear a mask during their entire 8 hours is a hardship, and I understand that, and where it can be avoided, it should be. We're also going to have to trust the public to be fair about it. I've been to several retail establishments since the governor's change on this has come out and the CDC's change on this has come out. And it's an honor system. But that's the reality of it. We need to give it to them. And looking at what the PIC committee recommends, I think that's reflected in this. And I think it's a good directive. Thank you.
I'll agree along, excuse me, with what we proposed. I'm just concerned about people who are very hesitant about coming back, and, I mean, they probably have the shot or vaccination, but they're hesitant sitting next to someone who didn't have the shot and not wearing a mask. I think that's something we're gonna have to learn how to deal with. We're gonna have to come up positively with a policy or what, I don't know how we're gonna handle that. But, I mean, as for now, I think we're gonna have to go like Commissioner Ebinger said, go on the honor system and go forward with that and work with that, you know, and hope that our employees do go by the honor system.
Commissioner Kaylee.
I would also hope that some of our staff that are feeling a little hesitant or on the fence still, this would be an encouragement for them to finally go in and make that appointment and get the shot. And it is a personal decision. It is not for everyone. You know, we know that there are medical reasons not to get the shot, but for those that can and are just haven't made the time yet, I would hope that they would. So,
Thank you for your comments. I think the PIC committee really wanted to align with, we've gone with the CDC recommendations all along. It's been a priority for us to make sure that we were following the message that we were hearing from CDC. Doing this in this capacity will continue to do that. I think that it's important to note on this statement that because of different requirements, we are still going to require masks in the correctional facility, the juvenile detention center, and Clay County detox until we're directed otherwise. That's important to note. And then because this building is also occupied by the courts have yet to make a statement on that. And so the Supreme Court order governing and continuing of the Minnesota Judicial Branch will be referred to regarding masking and social distancing in the courthouse. So I think that's an important piece too.
I would like to make a motion that we move ahead with this proposed language that we provided from the PIC committee, but I would like you to read that if possible.
We have a motion by Commissioner Gross to accept the proposed language from PIC.
I'll second that.
A second from Commissioner Kaylee. Just a comment quick before I read this. I think it's important to note that our community has done a fantastic job of keeping our community safe and healthy throughout this time. It's personal preference at this point to decide what your medical directives will be, but also what your practice will be. But I think going forward, no matter what, this board appreciates the continued effort of individuals to keep the community healthy.
Madam Chair, if I may, before you read the statement, and while he's not here today, Commissioner Campbell did want to pass along that he was supportive of this, following the CDC and MDH recommendations, with the contingency of ensuring that employees, that we support wearing masks to employees and citizens if they haven't received the shot.
Thank you. The CARES Act committee met for about 6 months with funds that we were allotted, and we worked really hard to address safe work environments and safety of our the community that comes in, the customers that come in. I think we did a really good job of that, and I'm hopeful that the actions that we took will help to reduce any fears that folks will have going forward. Effective May 18th, 2021, following the guidance of the CDC and Governor Walz's Executive Order 21-23, masks and social distancing will not be required in Clay County buildings or property. However, people who are not fully vaccinated 2 weeks since their final vaccine dose are strongly recommended to wear face coverings indoor and practice social distancing. The county will also continue to support the public and staff that choose to wear a mask while in county buildings and vehicles. Fully vaccinated people should also continue to wear a mask in our Clay County Correctional Facility, the West Central Juvenile Detention Center, and Clay County Detox until otherwise directed by CDC and Minnesota Department of Health. The State of Minnesota Supreme Court order governing the continuing of the Minnesota Judicial Branch should be referred to regarding masking and social distancing within the Clay County Courthouse. Any further comments? If not, we do have a motion and a second on the table. All those in favor of that motion signify by saying aye.
Aye.
Opposed, same sign. Carries, thank you. Steve, can you make sure staff changes the signage appropriately?
We will do that. Thank you, Madam Chair.
Thank you.
I think the last sentence of that is this Clay Courthouse, it should be Clay County Courthouse, but